Hello, Mr. Reza. Good evening, and hope you are enjoying the summit in Abu Dhabi. And this is the 18th Microcredit Summit, and I don't know how many other summits you have attended, but do you find any difference in this summit, and how are you liking the whole place?
Thank you, Rao. I am very much delighted to be here, and it's my pleasure to be here also. And yes, I usually attend most of the summits so far I can call up. So last year, I attended to the summit in Mexico. The earlier year, I attended to the summit of in Philippines. The earlier year it took place in Spain.
Yeah.
So many places I have attended, and actually I enjoy this summit because at this summit there are many people from different countries, from different MFIs. Not only the MFIs, different researchers on the rural economic sectors, different economists, different teachers, different students from different institutions. They gather together, and accordingly we learn from them, we share with them different presentations that we enjoy. We attend to the different breakout sessions, different plenaries. So by this summit, what we know, how we are benefited, according to this question, the answer is very simple, that we can know, we can put our attention that how the global people are addressing microfinance, how they are operating, what is their impact, what is their innovations, and how they are addressing with their tools to attack poverty. Excellent. So this year I see a big difference of designing these sessions, particularly the innovations, particularly focusing on digitalization. So it's a new idea in the world which is coming up, that is SMEs. So some integration process of health, education and other issues. And so in this way there are some new topics that I have seen, but I have heard from different sessions that wherefrom I have learned a lot. And I think this learning will be highly beneficial for our TMSS microfinance and other social development activities.
Very good, very good. See, now the focus has shifted from microfinance to financial inclusion. And also we have a clear goal now. By 2030, we are going to eradicate poverty. So goal is clear, and now it has become much broader in terms of financial inclusion. So slowly Microcredit Summit campaign is going to work not only with microfinance institutions, but with other technology providers, governments, investors. The whole range of players will be coming into picture. Thank you. Secondly, now I see that TMSS is one of the oldest organizations in Bangladesh. You have completed 36 years. You have grown beyond 1 million active borrowers. How does it feel? You know, now you are a member of the senior management of the organization. How do you feel? A sort of a satisfaction, we have achieved something, we have accomplished something, or you feel that so much more needs to be done? Restlessness that we need to achieve quite a lot. Well, how do you feel? What exactly are your feelings at this juncture when you have crossed 1 million borrowers and growing further?
Yes, this is a very good question for you. That first of all, I want to say that yes, obviously I have a vision, and our organization has itself is a vision that we are to serve the community people first. We are not only the money-making organization. So because we have grown up with a very small stage up to this stage, so from the very initial stage of starting of different socio-economic development activities, we are very much committed to the people that we will serve you to the best we can. So accordingly, we are trying to our level best. We are not only showing it by our documents to for the better of publications, all the research activities, and to know the rest of the world, including Bangladesh. This is the things that what is being abided by us very slowly. But the thing is that we are always true to our commitment. We are very much committed to our community people, that we have to serve them first. Well, in a business, think those who are involved in social business, profit is the logical sequence, but the first target is to serve the community people socially.
Yeah.
So we want to bring the social backbone of the people involved into our different activities, including microfinance, health, education, and other awareness raising programs and different social development activities. So I feel very better because TMSS, because we are very true to our commitment, and we are trying to our level best to serve the community people first. So to do that, we have a very strong, committed and hard-working group of staff, and our executive director, he is very much committed to the community people regarding giving the best service in Bangladesh. So based on these feelings, as because our team leader, our honorable executive director of TMSS, Professor Dr. Husnaira Begum, he has spent his full life for the development and welfare of the poor people. It was her commitment from the very beginning of initiating or funding this organization, that it is my commitment to bring the poor people from the poverty trap, and I will give them a very conducive environment socially. So to be a part of that, we are addressing different social development activities, different economic activities, and we are extending our all activities. Beside this, as because government focus on us and different private sectors, different financiers, different banks, including PKSF, they are seeing that yes, TMSS is not only earning money, but TMSS is very true to their commitment. They are serving to the people. They are creating a very conducive environment and congenial environment in terms of their socio-economic base in the society level. So that's why as a senior management level staff, I feel proud of it that I am a member of this well-committed organization who works for the socio-development activities of the poor people in our society.
See, Microcredit Summit campaign, you may be knowing that we have got Microcredit Summit campaign, you may be knowing that we have more than 3,000 members. I haven't seen any organization which has a department for health education and microfinance. You don't call it as a microfinance department, but you call it as health education and why so much importance to health, and that to health education? It's not health and microfinance. I am surprised that you are naming it as health education and microfinance. That shows your commitment and also your interest in promoting health education rather. So why so much of stress is being given? Can you briefly tell me why so much of stress is being given on health education?
Yes, I appreciate your question. It is also from our commitment that you know that TMSS has been working since 1980, and it has been revealed to TMSS that only microcredit cannot attack poverty. Microcredit is undoubtedly a very important and indispensable tool, but this is not only the tools. So if you can add health, education and different educational services to the clients and their family as well, so ultimately these three things, health services, education services and microfinance together can attack poverty, and you can bring this poor people from the poverty trap. Think one example that I want to mention, that think you have been shifted from poorest of the poor segment to moderate poor. All on a sudden you fall in problem and you have been confined in bed in the hospital with a chronic disease and with some difficult diseases. This disease can bring you or can throw you again to that ultra hardcore poor segment. So our realization is, if they are aware of their health issues, if they get tips from TMSS through our services, they will be aware of this and they will not fall in that unexpected situation.
Preventive health.
They will be aware of their preventive health preservation systems. So this is one. And another thing is that awareness, without awareing the poor people, you can provide them huge money, but this money will be resulted zero,
Yeah.
because you will have separate options to receive fund, because there are many MFIs working beside us. But only TMSS is the organization in Bangladesh whose main motto is to provide him the health awareness, health services, the education services, the microcredit services. So these three things can work miraculously to the cash hungry society.
Okay.
So that's why, based on these feelings, actually we have introduced health education and microfinance program. And the main thing is that because of this service, our dropout rate is lowest in Bangladesh, and our recovery rate is highest in Bangladesh, because people are feeling very happy because they are not getting such type of services to another MFIs
Good.
working beside us.
Very
So they are rushing to us, they are receiving our model, and they are becoming very happy, not only by the borrower, but also we are addressing their whole family, including the community. So the total community is very much happy, and that's why our acceptance in the community level are expanding day by day.
See, you have been working for so many years. You have got so many financial and non-financial services. There must have been a lot of transformation in the lives of your clients. Does TMSS have a policy of monitoring this kind of transformation? How do you do that, and how frequently you do that, and are there any evidences that the poor lives have been transformed? Can you briefly tell me?
Yes. First of all, what we do at the enrollment time of the borrower, we undertake a socioeconomic survey, and that is well recorded, and we keep it in a separate file of individual borrower basis. So on every 3 years after, we again undertake such type of socioeconomic changes, and we fulfill a prescribed format on that. So if you, and then before 3 years and after 3 years, what are the changes that we maintain a record?
On a sample or on a
Yes.
census basis?
No, census basis.
Not sample,
No,
census basis.
for census basis. And we also maintain another file regarding the changes of his lives. And based on that changes, we introduce different policies, that what type of new ideas and new policies should be injected into their regular life pattern. And accordingly, we introduce new policies of savings, of credit, and other things. And one important thing is that why their socioeconomic structure has been changing. It is only because of that we don't impose any specific loan products to anyone, because we have several types of loan products. People are rushing to us, they are choosing their products. We are not imposing our products, as because if we impose our loan products to you, that might not suit with your investment nature, and you can fall in problem. So health services, education services, and you have your own choice to choose the loan products. By what you will be in a sustainable performer in the field level.
See, Microcredit Summit campaign is very happy to receive the commitment of TMSS.
Yes.
Very good. I just want to know from you as to some highlights, 2-3 important highlights of the commitment you have made for this year, and also do you visualize any challenges in achieving
Yes.
that?
Yes, it is also a very important question for TMSS. The one thing is our first commitment that this year we will we will cover at least 1 million microcredit clients this year, within this fiscal year. So, out of that, 20% will be the graduation from our mainstream microfinance program. This year, our commitment is we will graduate 20% of our total borrower from the mainstream microcredit program to the AME, that means micro enterprises program, by which the untouched people, the poorest segment of people will get the opportunity to engage themselves as wage earner. Because if you know that if a enterprise is addressed, that means that we are not addressing only that particular client. According to addressing the enterprises, the poorest of the poor segment, they are getting the opportunity to get involved here, and they can start earning money. So this is our first target. Our second target is we will cover the BDS services, the business development services to the entrepreneurs, so that they become successful entrepreneur in the long run. And our third target is we'll try to our level best to cover 100% microcredit clients to cover by the health services this year. So
One
this is
service or other
yes.
will be.
This is our main. This three is the main target.
What
of
is the
TMSS.
advantage for TMSS in making the commitment? You committed, fine, but how do you see as an advantage to you, to your organization?
Our advantage is that people will put their trust in us.
No, commitment. You committed. The commitment helps you in any way?
Yes, definitely. This commitment helps us to become bigger. These commitments helps us to cover the wider range of the population. This commitment helps us to receive the acceptance by the government, by the private sector, by the stakeholders, by the civil societies even. So as because the external sides, whenever they will see that yes, TMSS has some sort of commitment and they are very true to their commitment. So ultimately we are receiving their support because without their support, without the government support,
the
private
moment
sector
you
support,
commit
we cannot
something, so you are bound to do it. You have got a goal before
Yes,
you.
yes.
So you plan and wonderful. See, do you have any advice to other microfinance institutions about the commitment? Do you encourage many of them to give the commitment?
Yes, already we have discussed with many MFIs, those who are working with us, and the top 20 MFIs. Our advice is that don't do only the microfinance. Please provide them the health services, provide them the education services, provide them different awareness raising issues, and bring them into your such type of service coverages, because we are not a money making organization. So people are expecting this type of services to us. So you better do what we do actually.
I have an important question. See, you mentioned about the health services and education. This. I have a general question to you. Should the microfinance institutions do this credit plus services
Definitely.
out of the profit they earn from microfinance, or do they collect charges from the clients and make this non-credit activities sustainable? Which is better?
No, the thing is that what we do, accordingly we suggest the other MFIs. What we do, we keep a portion aloof for addressing this type of services, like
Portion of your profits.
a portion of our income.
Okay.
So a portion of our income, this year more than 10% of our income is kept aloof for addressing health services and education services, because they are our clients. We are creating surplus. We are sustaining our organization only because of the clients. So the clients is our main focus.
So these services are free to the client?
Yes, absolutely free. Absolutely free.
Okay.
Otherwise, if we impose charges, they might say that why we will go to TMSS, we'll go to another hospitals, another sectors.
Good.
So it is our commitment also.
Fine. See, there's so many things are happening in the microfinance sector. You hear about responsible finance. You hear about financial inclusion. You hear about technology-related financial services. Tremendous changes have taken place in the last 10 years.
Yes.
How do you visualize in the next 10 years, where is microfinance going to be and where is TMSS going to be? That will be, it's a very, very mind-boggling thing.
Yes.
So you have any vision for the microfinance sector and also vision for TMSS?
After 10 years, so where we want to go, or what is our vision? That is, we want to cover all villages of our country. We want to cover at least 1/3 of the population in our country with these services. That is our first vision. Our second vision is we want to prove ourselves to the community people that we are the organization, those who are playing very vital role in lifting their socio-economic structure of the community people. This is one. Number two is we want to create some avenues for the growing entrepreneurs, because you know that Bangladesh is an agrarian country, but in future the economy will be the question of survivability of our economy will be dependent on the establishment of SME in our country. So within very short time, we are going to open an SME cell into our organization within its HEM framework, and accordingly we will cover at least 50% of our total clients within the SME coverage.
Okay.
So that by SME, the self-employment is not only being addressed. By SME, we will address the poorest of the poor segment of people by wage earning opportunities, because our main target is to make our country in a zero position of the poverty. And here we want to contribute a lot, and we want to be a part and parcel of that vision.
Thank you very much, Reza. Best of luck to
Thank you
you
very
and to
much.
TMSS.
Thank you. And we always consider you as our helping hands, as our ambassador to
Thank
TMSS.
you.